No one wants to hear the words, "you need surgery," but technology is making a lot of procedures easier than ever. And some new ways to treat pain before and after surgery are getting patients back on their feet like never before. And as I found out in a special medical moment just before 6, it's all taking place before you head into surgery.
I really don't have too much of a recollection of what happened. A semi failed to yield to us, and our car was crushed by it.
A friend of Kit Mathis's was killed, and he and 2 others were seriously injured in that auto accident last summer. The bed Kit is in today is unlike the one he spent the first 3 months in recovering.
At first, they just wanted to amputate it.
Today, Kit is at Allied Physician Surgery Center for outpatient surgery. If you look closely at Kit's right hand, you can see how mangled it is. A big improvement from amputation, and believe it or not, one of his lesser injuries.
Kit, I'm Dr. Diddy with anesthesia. I'll be helping to take care of you today.
Oh, okay.
Nice to meet you, man.
But as he continues with therapy for head, internal, and leg injuries, he wants to use his hand again. And that's where Dr. A.J. Mencias and anesthesiologist Shane Diddy come in.
For pain control, what we're going to do is a nerve block. That's something that we do here in this room before we go back for surgery.
Dr. Mencias saved Kit's hand initially, but today is hoping he can make it work again.
So today what we're going to do is free up his middle finger so that it moves better, take out a plate and screws that's in there, and also transfer a tendon from his index finger to his ring finger to allow that to straighten up.
That surgery is very painful, so Doctors Mencias and Diddy are using what's called an on-QC block, a block that will essentially control Kit's pain up to 3 days after surgery. Dr. Diddy explains to Kit how it will work.
I know where those nerves lie.
Dr. Diddy marks the area on Kit's shoulder where he will insert a needle and thread-like catheter that will deliver pain medication for days to Kit's hand.
But if you notice your arm jumping or twitching, don't try to stop it, because that's what I'm looking for.
Working in tandem, Doctors Diddy and Mencias spend the next few minutes making sure the on-QC block catheter is in the right spot before heading into surgery.
So you see that little switch there?
And we'll hook that catheter up to a pain ball. Okay, it's the size of a large softball. Okay, and it's full of local anesthetic.
With the catheter in place, the needle used to thread it in is removed, and when the ball is empty in 2 or 3 days, Kit will be able to pull the catheter out, much like taking off a Band-Aid. Dr. Mencias says this type of pain technology makes all the difference in the world for patients.
I use it on pretty much all my patients that I know are going to have more than 2 or 3 days of pain. And when they come in, they're just so happy because they had no pain after surgery.
And the news Kit was most hoping for?
Hopefully, I'll be able to have my right hand back.
And as far as putting the pain block in him to get ready for surgery?
Hey, Kit. How you doing, buddy?
I don't know, okay.
Yeah, did that hurt at all?
No.
The next stop is the operating room, where through his cell phone, Dr. Mencias gave us a shot of surgery he was performing that would straighten out Kit's hand and get him back home tonight, pain-free. We're happy to tell you Kit went home that night as planned, and thanks to the on-QC block, his pain level was non-existent, which is rare after such extensive surgery. Dr. Mencias says this is the wave of the future, and he's already using it for hands, arms, ankles, feet, knees, and hips. He says it's basically a win-win for any patient who would be in pain for at least 2 to 3 days after surgery. And because there is less anesthetic, patients bounce back faster, have less nausea, and can get back to their routines quicker. For more information, you can go to WNU.com and click on this story.